The fear of fistula recurrence after surgery is real, and we'll break it down to understand why it happens and how to prevent it. I'm Dr. Nitish Jhawar, laparoscopic, robotic, and laser surgeon working at Apollo Hospitals and Neolta Clinic, Navi, Mumbai. Anal fistula is a tunnel-like inflammatory tract which connects the anus to the skin and keep discharging pus, blood, and mucus. It can have periods of remissions when it is silent and you feel better, barring having some discomfort and small boil, but it resurfaces in some time. Let us see what are the factors which affects the outcome and prevents recurrence. There are four important pillars of a fistula care. If we see these four pillars, one is the disease itself, the patient factors, the choice of procedure, and post-operative care. All are equally important. They are like those pillars which will give good strength to the structure. If we look at the disease per se, we need to see how complicated or simple the disease is. What are the number of tracts? What is the branching pattern? What is the stage? What is the duration of the disease? And do some investigation to give us a proper roadmap. And that is where MRI comes into play. We do a MRI fistulogram to delineate the fistula and then proceed with the surgery if at all. The second important factor is the patient factor itself. This includes the age of the patient, the comorbidities like diabetes, tuberculosis, Crohn's, malignancy, HIV, obesity, and some habits like smoking and alcohol. All these things can negatively affect the outcome, and controlling and optimizing these things help in recovery and preventing the recurrence. The major thing is the operative concern. What should be the choice of surgery? If you see, there is an array of procedures to treat fistula. So we can have a fistulotomy where we cut open the tract and lay it open. We may have a fistulectomy where we remove the fistula completely and then repair the sphincter. Laser is one of the most commonly used and preferred treatment by both patients and surgeon now, but we don't use laser in isolation. It has to be combined with some kind of a ligation or excisional procedure. We do techniques like DLPL, which is the distal laser and proximal lift. We do things like SLOT, wherein we do a submucosal ligation, or we do a primary fistulotomy with distal laser. Now, who chooses the procedure is very important. That is where patient and surgeon, both of them have to come on one page and decide which procedure is best for you. Now, if you let the expert decide rather than you deciding the procedure, you get the maximum benefit because your expert or the surgeon knows which particular technique is going to work for your kind of fistula. The fourth important is the post-op care. Now, post-op care is of utmost importance because after the procedure, you take around 4 to 6 weeks to recover from this. Now, this is a long haul. There are certain things which you need to maintain. A daily cleaning is important. Maintain a good hygiene. Do hot sitz bath to keep the area moist and clean and clear of all the stool debris. You can use irrigation with a bidet also, or use water jet to keep it clean. Your diet should be very rich in fibers and nutritious. You need to take a lot of green leafy vegetables, salads, fruits, whole grains, so that there is enough fiber in the stool so that you can pass well-formed stool without causing undue strain on these stitches or avoiding loose motion wherein the stool can percolate in the crevices of the fistulous wound and can create problem. A good hydration, avoiding prolonged sitting helps you a lot. We can't overemphasize the importance of regular checkups. So you need to go to your surgeon for repeated dressings and to make sure that the wound is healing properly. You can resume your regular work between 3 to 7 days, but this particular care will keep on going from 2 to 6 weeks, and always look for early sign of recurrence. If you see that anything is not healing as it is supposed to, that is the time you need to go and visit your surgeon again. So if we want to summarize that what are the 7 crucial steps to prevent the recurrence, the first and foremost is the proper diagnosis before surgery and mostly a MR fistulogram to delineate or to map the tract. The second important thing is choose the right surgical technique, and that is where you and your surgeon, as I said, should be on one page and decide what is best for you and let your surgeon take the lead in this particular decision. Don't force the technique of your choice. Third important thing is the post-operative care, wherein we talked about the importance of hot sits bath, a good diet, good hydration, and the wound care which is suggested by your surgeon. Some medications are given after the surgery in the form of antibiotics, anti-inflammatory, and some stool softener. Those medicines you have to take regularly and in proper doses. Avoid constipation, take a high fiber diet, maintain a good hydration, and do some exercises and remain active so that your gut health is good. Avoid smoking and alcohol intake when you are recuperating from this illness, and a regular follow up with your surgeon is very important. So don't skip the review visits. Healing needs monitoring. Wishing you all the best. Hope this helps you heal better. Thank you for watching.